Hello everyone and welcome to another episode of iChat TV. The outbreak of coronavirus in Kenya has exacerbated the living conditions of the Nubian community and many other members of ethnic minorities who face structural barriers accessing identification documents and are at risk of becoming stateless. Today I'm interviewing Yasah Kimei, who is an activist from the Nubian community in Kenya and is going to give us an insight into the situation in Kibera, the largest urban slum in Africa, where 500,000 people are living without access to water, sanitation, and where social distancing is simply impossible. Yasah Kimei, thank you for being with us today. Yasah, you are an activist from the Nubian community. Who are the Nubians and why are they at risk of statelessness in Kenya?
Nubians came into Kenya over 100 years ago. They lived in Sudan, and during the colonial time, they were brought by the British government to come and fight for the Kenya African Rifles back then, before 1887. So they fought, worked for the British government. That is when they were issued Kibera. By then, they called it Kibra, meaning a place which has forest. By then, Kibera had forest. It was forest. They were given 4,997 acres of land, whereby, due to discrimination and challenges of access to documentation, the land has been reduced up to 288. This land title deed was a communal title which was issued in 2013, but it had 300 acres where the national government, again, through the National Highway Authority, managed to take 12 kilometers to create road construction. But they are still looking at option on how they can compensate people. And the issues of discrimination on access to documentation started after 1963. They were discriminated, whereby now the registrars in Kenya say Nubians come from three countries. They come from Sudan, come from Uganda, and Kenya. And that is why they go through discrimination, because you cannot know who is a Nubian from Kenya and who is a Nubian from Uganda.
So Nubians were not at risk of statelessness before, were they?
So Nubians were not stateless before, but they are at the risk of becoming stateless. They live in a country where they know this is the homeland, but they have to notify the government at the age of 18 that they are Kenyans. And how do they do that? Through vetting and through questions that they are not able to answer. An example question is, a registrar can ask you, have you ever eaten matoke? Matoke is a Ugandan word whereby Ugandans use to call banana. In Kenya, we call it banana. In certain part of Kenya, they call it matoke. So when you say you've ever eaten matoke, they discriminate you and subject you to have been a foreigner, to be a Ugandan. They haven't been recognized as Kenyans completely, because Kenya has 44 tribes, and the 44 tribes are among the tribes that are recognized by the constitution. The Nubians are called others. So when you're called others, meaning anytime your nationality can be stripped off.
Tell me about the humanitarian impact that COVID-19 has had on the Nubian community in Kenya and other vulnerable groups.
We have close to 200 cases in Kibera, and Kibera is about has a population of close to 400,000 to 500,000 people. There is no social distancing. There is no good sanitation. There's no water. There's lack of security. Biggest challenge which the communities are facing is now lack of food. But now the challenges come into whereby you need identification cards so that you can be given food. But now this is so discriminating towards the stateless communities who do not have access to these documents. And at the moment, registration offices have been closed until further notice. And it's slum areas, so those challenges are rising day by day. The landladies, the landlords who keep on harassing people for rent, For the youths, they're just jobless, seated, doing nothing. There are national initiatives that have been brought by the government that should benefit the youths, but definitely the Nubian community and the stateless communities are not able to get these jobs. Why? They do not have these documents, identification cards to get this job. So their living conditions at this moment is worse, and it's getting worse day by day. Sanitary towels, diapers, girls and babies are suffering in terms of that area because there's no one who's been able to focus on distributing on those essentials.
How can people follow government guidelines when they live in slums like in Kibera? I mean, where social distancing is simply not possible when they don't have a job and they don't have access to water and food.
Only close to 10% of people living in Kibera are the ones who are following these directives by the government.
Washing your hands for at least 20 seconds is one of the main measures that people are following to prevent the spread of the infection. Tell me more about the lack of access to water in Kenya and about how people are coping with it in Kibera.
Lack of water in the community is a big challenge. Where other initiatives such as Shofco, they've worked with other organizations to be able to bring water in the community. But we've never seen any government initiative bringing water in the community. But at least there is one time Kenya Defence Force, through at least other people who are human enough, they felt lack of water is being needed, so they brought at least some tanks of water. But in terms of frequent distribution of water, there's no. You could find people even washing clothes at the sewer line, the wastewater which has been used and is contaminated. You will find children playing around there. Washing hands has been a biggest challenge. Now it is civil societies and other organizations putting tanks in the streets and parts of the areas whereby in stages so that people can be able to wash their hands. But could we say if we believe corona is there, then very many people are at risk of containing this disease because even distribution of soaps, there's no distribution of soaps. The only water which is available is the ones for washing hands, the tanks which have been placed on the streets. But other people, they have to pay, and one goes for close to 20 shillings, and 20 shillings is close to 20 cents. Not so many people are able to afford this. So, if the government could be able to find a solution of how to distribute water, how to distribute sanitary towels, how to distribute food, at least we can be able to find a solution on how people can be able to contain themselves in terms of contacting this virus. There was an article that I was reading, it said close to 200 million Africans will be affected by coronavirus, and close to 100,000 people will die within 2 years. So, if that is estimated, where are we as Kenya? And we are thinking about opening our economy, thinking about uh, lifting up the lockdown and the curfews, yet the cases are exceeding.
Wearing masks is now mandatory in Kenya. A new bill criminalizes people who don't wear it. Have vulnerable people been arrested for not wearing one?
There is a bill that is there where criminalizes people who do not wear masks, but they have not issued masks to the community. They expect the community to buy those masks. They don't even know how we're going to buy those masks, where we're going to get the money to buy the masks. Jack Ma had donated masks. We were told it will be distributed, but we've never seen even a single one. Personally, I've been chased out by police. I've had a fight closely just because I was handling my mask. But I've seen so many people who've been arrested due to not having masks. So many now they use it as an opportunity of corruption. You are arrested, then you are taken for quarantine. If you don't want to go for that quarantine, then you have to pay something small. Now it's the community fearing now to be arrested instead of fearing the virus. which is quite challenging. The bill came whereby criminalization is if you don't wear a mask, you pay 20,000 shillings, which is impossible for common um, Kenyan. Or if you don't pay, you spend 6 months in jail. And the government have not even have had an initiative of even sharing those information through social media, through TV station or mainstream media, so that they can be able to make sure that this information is going to the public. All they're doing is just arresting people, and they're not coming up with precautions. Masks are being sold by people. The cheapest mask goes for 20 shillings. That is close to 20 cents US dollars. So 20 cents, people are not able to buy this mask. This leads other people recycling surgical used masks. They go and wash them, they go to the streets and sell it back to the community. Now you can see the biggest challenge is that are we really fighting the virus, or we are still bringing the virus close to us?
I've seen many cases in which people that are undocumented or people that are stateless don't have health access, don't have access to health services in their country. Is it the case for the Nubians as well?
Um, the stateless communities, for them to access services is hard. It's not only for the Nubians, but also these other recognized communities. Because I can give you an example: access to education. It's mandatory for you to have birth certificate. So this one violates the human rights and right to education, which is universal right. If you don't have identification card, you cannot access buildings, or you cannot access services such as hospital or bank account. So any community who do not have identification cards, of which close to 5 million communities face discrimination in access to documentation, are locked out in services such as healthcare, such as bank opening, such as SIM card registration, such as going to hospital. So many of them have been affected. And now everyone is focusing on COVID-19. So other cases are challenging. But there are small hospitals, we call them dispensers or clinics, whereby at least due to small cost, and we thank their organizations, civil societies, that they've turned their work to health facilities. So they assist these communities to access services. Although it's not enough, but it's something that they're able to access these services.
Has there been any direct response by the government addressing the needs of these people following the outbreak of COVID-19?
If the government has even neglected its own registered people, do you think they can be able to think about the discriminated communities? So, yet, and not anytime soon. We've seen them, they're talking about locking down Kibera, which has more than 200 cases, and cases keeps on increasing, but they don't have a strategy of how to lock it. They don't have numbers. They don't even know who is going to be assisted, and if they're going to be assisted, the stateless communities, due to lack of documents.
Failing to protect the Nubian community also means failing to protect the whole population of Kenya from the spread of the virus. There is a greater risk of infection if we leave these people behind. Do you see the possibility of opening a legal path for these people available? Do you think this could actually represent an opportunity for the Kenyan government to legalize the status of the Nubians in Kenya?
Yeah, I believe this is the time the government should work up, and it's not only for the discriminated communities and stateless communities. This gives an example of, it makes me even feel like the government does not even know how many people we are in Kenya. So if the government is not able to sustain 46 million Kenyans, what are they telling us? They're telling us we do not need them. So if they are able to even contain the numbers which they had for census, what are they telling us? That they are not able to assist the entire nation? They don't even know who is who doesn't have this document, who has this document.
Tell me about your work. What are you doing on the ground? What are you doing at the moment to support vulnerable communities in Kenya?
We have weekly community radio. where our paralegals have been going for sensitizing the community on social distancing, on keeping clean, on washing their hands, and using sanitizers, using soaps, and also trying to help the community in understanding the way how they can contain this virus. Personally, I've also been working with other civil societies. We've had a group called Kibera Food Drive. They've been assisting in distribution of food and working together with the community. We've had several initiatives that are supporting the community. As Nubian Rights Forum, we are limited, so I won't say we've been doing a lot in terms of empowering the community and assisting, but we would like at least if there are donors who can work with us in fundraising, in bringing more funds so that we can be able to assist. Because my main focus and the organization's focus is the most vulnerable refugees, because the asylum seekers who are within Kibera, the refugees who are within Kibera, and they cannot come out, they fear, and they're the stateless communities, the Nubian community. So if we get support and funds, we can be able to look out to those people who have not been identified by the government, and then we can move forward. And I will call upon UNHCR to come closer and work together with these civil societies to find out how many people need assistance.
Yasah Kimei, thank you.
Thank you.
And thank you for being with us for another episode of IHR TV. From myself, Margherita Cargasacchi, until next time, goodbye.